David, for today's discussion, I thought we'd focus on sort of big picture issues. What's sort of likely to drive the policy agenda over the next couple of months and probably throughout the year, particularly from the perspective of policy of interest to the kidney community?
I think that's a good approach right now. I think that's where we are. We're seeing big picture emerging and pathways for a new administration and a new Congress.
So the first topic I'm curious as to your perspective on. It seems like the Biden-Harris administration and the Democratic leaders in Congress want to use reconciliation to expand the Affordable Care Act. What's happening with that issue?
Well, I think right now it looks like that is mostly centered in the House, and I think that's probably makes sense because the House has got a bit of a bigger margin, although it's still relatively thin, to move along. And so there's two committees that are going to really drive that a lot in the House for our listeners. One is called the Energy and Commerce Committee. And I know they may think Energy and Commerce, that's a strange name. But Energy and Commerce is one of the oldest and biggest committees within the House of Representatives. And health is within that. That's where Medicare Part D was created some years ago when I was on the Hill. It's just a very important committee. And the other one, the House Ways and Means Committee, or they control the money. The joke sometimes always on Capitol Hill is it's not Ways and Means, it's ways to be mean. Because they can inflict some pain on you. But Ways and Means has already started. They've already started looking at what they're going to want to do to kind of really bring the ACA back into a more robust, well-funded position. And they've got some big supporters coming out in favor of that, including America's health insurance plans, the American Medical Association, and the U.S. Chamber of Commerce. So that's an interesting, powerful combination, wouldn't you say?
So what's driving that support? Why are these organizations pushing for these types of changes and expansions?
Because, it is both healthcare and it's also business. Because a lot of the ways in which the previous administration went after the Affordable Care Act really cut out some of the things that would have made it more robust and made it more affordable for people. So they basically are saying Ways and Means would like to see anybody who's at 150% of the poverty level would be eligible for fully subsidized plans. And so that's regardless of whether you've expanded Medicaid in your state or not. So that's a big step. And it's regardless of your income. 150% of your income at the poverty level. But regardless of your income is another one, which is the cap, that regardless of any income, no one in the United States would pay more than 8.5% of their income for health insurance.
So I'm trying to sort of think through what's happened in the past. So let's say both the House and Senate reach agreement on these expansions. They're passed. They go to the president signs them. Then what? I mean, I would assume some of the state attorneys general from states that may not be in favor of this would oppose it, and we'd be back in sort of the legal process. I'm just trying to sort of think through what's likely to happen over the next couple months and years.
I'm not sure if it would be as easy to challenge that, especially if it's not coming out of state matching Medicaid funds. If it's coming out pretty much directly Medicare and other expenditures for plans that are in the marketplace created by the Affordable Care Act, that would make it a little bit more difficult, I think, for attorneys general from conservative states to do much about. I don't think that would be as easy a lift as some of the other things like the mandate and taxing power that has been challenged in court. So, and we're also going to see what Energy and Commerce is going to do. It's beginning to start its process as well. I think that Energy and Commerce is going to try to create some more incentives for states to pass and expand Medicaid. So I think that would be, looking at these, I think these are pretty strong, solid moves that they probably could do well, and they would be restoring a lot of the things that were already okay by the Supreme Court when it did say the Affordable Care Act was constitutional. And so these issues that really would kind of shore up the marketplace, I think are probably already kind of been mulled over and decided.
So before we move to the next issue, I just have one more question. You mentioned that the U.S. Chamber of Commerce, with their support, does that increase the likelihood that some Republicans in the House and Senate would support these expansions?
I would think so. It's also a 3-year reestablishment of the match. So, the generous match in federal funding. So at that point, businesses are looking at that and saying that's going to really help. That's going to stabilize workforce issues. It's also, these things are going to be useful for insurance companies. And quite frankly, the business world they know how expensive and, you have to negotiate as our executive vice president for insurance for those of us that work at ASN. And as you know, so much of the dollar that is available for workers everywhere goes to healthcare. So the more that the government is willing to help control that and stabilize that, I think the more businesses you see get behind it, and it definitely starts to erode into that real. I think the Republican groups that are more likely to consider this as a good step forward.
So the next sort of big picture issue sits both on the legislative side and the regulatory side, and that's this focus on transplant policy. So help us kind of frame what's likely to happen this year related to transplant policy.
Well, as you know, we got a big win at the end of 2020, which was the lifting of the 3-year limit on immunosuppressant coverage. So that's really great. And I think it's got people really focused and energized. There was something that happened just recently that I think I want to just be clear about, because I don't think it is necessarily a bad omen. It just is a reality. And I think we talked about this before, that the Biden administration did come in and put a hold on any regulation that had not gone into effect on noon on January 20th, 2021, so that they could review them. And that caught up the Organ Procurement Organization metric rule, which is one that ASN the policies contained in that rule are policies that ASN has been very supportive of and been working very hard to see put in. We think this is going to be like the others, that this is just basically a review process. So there's been a little bit of time added on before it becomes effective, but it does have a comment period. ASN has already made one comment letter, and we'll do another one about its support. And mostly in the kidney community, the groups that supported this seem to be in the same place. There are some groups that opposed it, and they seem to be in the same place. So I don't think there's going to be a lot of shifting there, but in case anyone has heard that was put on hold, that's the reason why. As you know, it's customary as a new administration comes in.
So if you're placing odds, what would the odds be that once this review is completed, that the final rule would be implemented?
85-90% odds, 85-90 high. There's a lot of interest in general about transplant and how to increase it. That was also, a good part of what was done in the models that we're going to talk about in a minute. And, at the same time, it's well known that there are some serious disparities and equity issues in transplant, and in terms of just who gets organs, who's most likely to be able to find a living donor, and they do follow along certain lines that are drawn socioeconomically, and so I think that's going to be caught up with the equity push from the administration. And we've already begun conversations with them because they clearly know that transplant, if you're talking about healthcare and you want to talk about some inequities, that's a big one. So I think that's a pretty wide open area that you could probably put down, your hat just about anywhere, and you'd hit an issue in transplant that probably they would really be interested in diving into.
Yeah, and I think just to emphasize a point there, because I agree with you, I think this is a huge opportunity for the community to really make a difference in this arena. And as the ASM president, Dr. Susan Quaggan, announced earlier this year, ASN is launching a new committee. That committee is the Healthcare Justice Committee. Ray Bignall, who's a pediatric nephrologist in Columbus, Ohio, will be chairing that committee. And we're really excited because I think they'll obviously work closely with both the ASN Policy and Advocacy Committee, but also the ASN Quality Committee on these issues. And as you said, there's a real opportunity here. Why don't we sort of pivot to our third and final issue, which is there seems to be, this is fully a regulatory issue, I believe. There seems to be a lot of discussion around both the mandatory model and the voluntary model. And just if you don't mind just providing us an update and just clarifying sort of what's going on with the two models, that'd be really helpful.
Well, let's deal with the mandatory model, the ETC model first, the ESRD treatment choices model. I think that surprisingly, I think that one may be a little less complicated at the moment. That has started already. ASN would like to address some issues that the Innovation Center at CMS has already made clear would have to be addressed through rulemaking. So there's going to be rulemaking throughout the process of that model. So there are some issues about how they benchmark and also how they attribute home dialysis patients to a facility if the facility is also seeing home dialysis patients, but not actually treating them, like they're actually sending them to a facility that they have a contract with that specializes in home dialysis. So that's a little bit of a rub there that we need to figure out because we don't want to. We've had a lot of success with building programs around, that were kind of like centers of excellence in home dialysis. So we don't want to go backwards on that, and we don't want a model that would incentivize organizations to go backwards on that path. So that's where ETC is. The voluntary model, I am much more concerned about, and it's supposed to start April 1, and we're going to have to see. We are making recommendations, but at the moment, as you might expect, I don't think the agency is going to make major changes in it until it has new leadership appointed by the administration. And the healthcare leadership appointments are, in the Senate it's going to take time. There are other things that are pressing on the Senate, can cause things to drag out. So we really need the new appointment of a new CMS administrator and a new deputy administrator for the Innovation Center at CMS. And then we can really sit down and go over this. But there's a lot of concerns on some of the financial withholding and payment issues, particularly if you're a hospital-based dialysis facility, in what's going on in the model, the voluntary model, that I think is going to cause some significant drop-off in the number of number of groups that applied and whether or not they will participate. And that's what we saw also with the ESCOs. So we'll have to see exactly what the agency is willing to adjust and how many groups decide to stay with what they have or decide to drop out. So we're seeing a lot of, the way I would just say is, a lot of serious questioning and review in people's minds about whether they want to be in the voluntary model.
It's really disappointing. And I'm struck too that twice you've mentioned challenges with the Centers for Medicare and Medicaid Services. And it points to the point that the administration really needs to name and hopefully get confirmed the leaders of CMS, Secretary Becerra in terms of HHS, et cetera, to move some of these issues forward.
The candidate that's being talked about a great deal in the news to be the CMS administrator is Shakita Brooks-LaSure. And she has a lot of background in democratic healthcare issues with the creation of the Affordable Care Act. And I think that she would be a very strong administrator. She's been managing the health work of the Manat Phelps law firm here in D.C. But she would be great. But I mean, that's going to need to be approved by Congress or by the Senate. And of course, I'm sure that they will be grilling her about her feelings about certain things that were done, in whether she approves of them or disapproves of them or is agnostic on them, that were done in the previous administration or that will affect the Affordable Care Act. So I do think that they're trying to get the nominee for, to be Secretary of Becerra through, and that's still going to be taking a little bit of time.
Yeah, so we've ended where we started, which is this focus on the Affordable Care Act, and obviously she has considerable expertise with the law. So I think you're right that it's another sort of indication that that's going to be the priority for the administration, at least for at least the first 2 years of their term. So David, thanks. It was great to catch up with you.
Thank you, Todd. Great to talk to you.